Using the latest technologies has been something that Fraser Health prides itself on, and so having an electronic health record and having fully electronic documentation has been a pillar for that to occur. Leveraging AI on top of that is just a natural fit for us. We've been really happy with how the generative AI pilot has gone with Google and MEDITECH. And one of the things that we've been able to capture is real-time meaningful feedback from our clinicians and providers that are using the tool. We surveyed our pilot participants to see how they've been enjoying it, and over 95% would recommend the tool to their colleagues, which is huge. Providers are finding that their cognitive load has improved as well. So what we noticed there is that there's been about 87% of users that have used it have mentioned that they've had a reduction in the cognitive load that it takes to perform the discharge summary. We also have noticed that there's been a 7-minute savings in discharge summary time, which it may not seem like a lot, for an individual discharge summary, but you can imagine providers are discharging more than one patient a day and definitely more than one patient in a week, and those minutes add up. No one will actually say it, but a common barrier to performing a discharge summary is actually having to mine through the chart and do the discharge summary course and hospital section. So with AI augmenting that and allowing a provider to free up that time to do more clinical work, that's huge. One of our main chief of staff surgeons in our regional health authority used the tool for the first time just a couple of weeks ago, and he pinged me after and he basically told me that even though this was a complicated stay for a patient, having gone to the OR, gone into the ICU post-operatively, and then come back to the ward before discharge, he used the tool to do the discharge summary, and he found it to be much more comprehensive than anything he could have captured by mining through the chart, and he was really impressed with it. In terms of the vision that we have, we obviously want to provide the best, highest quality care for our patients, and we feel that using this tool will allow our clinicians to do that. We also have a vision for our providers to create a frictionless digital provider experience. What I mean by that is removing those sources of friction that can sometimes impact the clinical workflow and lead to provider burnout and provider frustration. Having a tool that enables them to save time but also provides high quality care is something that we really value, and I think we align quite closely with MEDITECH in that regard. I think every organization will find value in utilizing the AI tool for discharge summaries. We know that discharges are universal. Whether you're in a small community rural hospital or a large academic tertiary care site, you will be discharging patients. And finding a tool and having a tool at your fingertips that can actually reduce cognitive workload and improve provider satisfaction is something that I think every organization will find value in. I do know that we have had a lot of customers of MEDITECH approach me personally and ask about our experience, so I know there's a lot of interest, and I would say it's a great time to start using the tool because I think it'll provide a lot of satisfaction to your providers.